sleep appliance is what we make for patients who have sleep apnea. And when they are diagnosed with that they have sleep apnea, we can either fabricate them an appliance that they put in their mouths, and it keeps their mandible forward and slightly open to prevent their tongue from falling back and touching their soft palate. And by wearing this, it makes them get uninterrupted sleep so that they can sleep all night and not having to wake up and toss and turn, so they get into the deep sleep cycles. So the Cpap, if you know anyone who's worn one, they hate them. They call it the Darth Vader mask. You put that the Cpap machine on your face, and it does positive air pressure into your lungs. That helps keep your airway open. There's lots of problems that occur with wearing Cpap. A lot of people complain about that the mask leaks. If they turn at all, you get that hissing that happens with the Cpap, and the problem with that is it wakes you up. So there are a lot of benefits to wearing the Cpap, and it is the treatment of choice for a lot of people who have severe sleep apnea. But for people who have mild and moderate, which is a fair majority of the population, these oral appliances are very nice. Once again, it helps you to get uninterrupted sleep. So on my last video that I posted, the sleep appliance looks like this. It does snap into the top and the bottom, and then it's connected with some bands, and these bands are interchangeable. They have different lengths to pull you further forward and further back. Right now my setting is at 3. What we do when we make the device is we figure out how far forward your mandible can go, and then usually we start you at 70% of how far forward you can go, and that ends up being number 4 on the bands. When I first got this, I actually was at 4 and it hurt my jaw, so I went down to 5 and then down to 6, and then I got used to it, and then I went back up to 5 and then 4, and then I was still snoring a little bit and getting the tongue blockage in the back, so I'm now at a 3, and that's my sweet spot, is number 3. Number 3 for me keeps my tongue all the way forward so that I breathe all night. I don't wake up anymore. I have a lot more energy, and I can not fall asleep during the day or feel tired. So yeah, people say that looks like a lot of material in your mouth. It does take a little getting used to. I usually tell people for the size of it in your mouth, it takes about a week. Getting used to it with your jaw joint, it takes about 3 weeks, and the tightness also takes about a week. So this is how you put it in. You slide it in sideways, right down, and then when you lay back, it just keeps your mandible forward, like that. That's how you wear it. And to get it out, it's a little tricky. Like that. So your lips are able to stay together while you wear it. It does have a little open area up in here, so that if you are a mouth breather and you can't breathe through your nose, it won't keep you so closed that you feel like you can't breathe. So there's lots of benefits to wearing this as opposed to the Cpap. A lot of people that wear Cpap and that are supposed to wear Cpap, it's really nice because they will actually wear this in conjunction with that. They know they're supposed to wear the Cpap, so they wear the Cpap, but a lot of nights they get ready for bed and they're like, I don't want to wear the Cpap tonight. So they put this in, and that's able to keep their mandible forward and their tongue forward, and they're able to breathe all night, and it helps a lot. So this material, we actually send the impression. Once again, it's not a goopy impression, it's a digital impression, so they're really easy to take the impressions on. We send it to Germany. The company that I use is called OptiSleep, and you can look that up. I've been very happy with them. The fit on these are 100% every time. I never have issues with them, and that's the new way to do it is with digital impressions, not goopy impressions. But it took me, when you get them, they're really tight when you first wear them, And when I deliver it to the patient and I try it in their mouth to make sure they get used to it, it feels very snug. And I tell them, give it about a week of wearing it each night. It'll be tight for about a month, a week. And then after that, it still is tight to come on and off, which you want it tight because you don't want to wake up in the middle of the night and subconsciously take it off. So they do want it to be snug, but it's not so tight that it feels like it's making the teeth ache or anything like that. And then also the jaw joint gets a little tender, and that took me, like I said, about 3 weeks. So as many of you know, I don't live in Salt Lake, but I work in Salt Lake, and I have about a 35-minute commute. And I would catch myself getting tired. You know how when you're driving you feel like you're getting tired? I wouldn't really doze off, but I get to the point that I could see myself falling asleep. So I'd have to turn up my music or roll down the windows to kind of blast some air on me. But ever since I've worn this, I do not feel tired on my commute at all. Even if I stay up late, my wife gets worried about me that I'm going to fall asleep at the wheel. And by wearing this every night, I have a lot more energy. I have more energy with the kids. I don't feel as tired throughout the day. So it's been biggest ones for me is I have a lot more energy than I used to. So if any of you wear a Cpap, when you travel, it's like a laptop. You have to open up your laptop, you have to pull out the Cpap, they have to look at it individually. So I know a lot of people who wear a Cpap, they hate traveling with it. So a lot of people make this even just for travel, so they don't have to bring the Cpap with them. Because this, I put in my carry-on, I wouldn't put it in my checked luggage. It fits in a small little retainer case, and you go right through the security without any problem. So it's really nice having this as opposed to having to lug along a big Cpap machine. I'll be the first to tell you this does not replace a Cpap. Cpap, it's blowing positive pressure air into your lungs, so it really helps. But the problem that we're finding, if you talk to most physicians, sleep physicians and regular physicians and PAs and everything, they say that people have them, they sit by their bed. There was an old football player who used to play for the Green Bay Packers. He actually died of him not breathing during the night, and he had a Cpap sitting next to his bed, and he didn't wear it. So the compliance for a Cpap is like 10%, which means out of 100 people, only 10 people are wearing it every night. So this is great to have in conjunction with, but I have a lot of patients, we've done quite a few of these since I took the course, where they are wearing only this, and they can tell that there's a huge difference. And we actually, included in us making this, is you get another sleep test that we give you after you've worn it for at least 3 months till you're used to it, till you feel good about the band length that you have, and then we can actually compare. There's a number called the AHI. That's how many times in 1 hour you stop breathing more than 10 seconds. So if you stop breathing for 9 seconds and then you breathe, it doesn't count it. So we can compare the initial number without wearing a device or your Cpap, and then after you've worn this, then you wear this with a sleep test, and the numbers go down to where you're not stopping breathing in the middle of the night. Actually, dentists aren't allowed to diagnose sleep apnea, and we're actually not allowed to treat sleep apnea without working with a sleep physician and with your regular physician or your PA or whoever you use. So what we do when we start out is we have you take a sleep test, and once we see what that is, we send the analysis to a sleep doctor, and the sleep physician, he will give the diagnosis and his recommendations. We've had some where the sleep test comes back where it's severe, and they say, we only really recommend the Cpap, but the majority of them say that, hey, wearing a sleep appliance could be a great first line for you, wearing that as opposed to a Cpap. And then we also work in conjunction with your physician, and they give us a prescription saying, I want you to fabricate a sleep appliance for Mrs. Johnson who needs this. And by having the sleep physician and your regular physician, both of those, then I'm allowed to make this, as diagnosing sleep apnea is for physicians only. To first be diagnosed with sleep apnea, if you think you have it, you come to our office, and we do like a little questionnaire, and I don't want to make the appliance if it's not going to help you. There are certain cases where it won't help you. So if you are wondering, you come into our office and we talk about it, we have a little consult, and then if I feel like you're a good candidate for it, then you actually rent out my sleep test. It's a take-home sleep test, and it's very nice. All my patients that have used it, who have had sleep tests at other places, it's at the comfort of your own home. The only thing that you wear is it snaps on around your chest, and that measures when you stop breathing. You have to wear a thing that goes under your nose that measures your breathing as well. And then the last thing is you wear a pulse oximeter on your finger. So you only have 3 things that you really have to wear. And so patients feel like they can still turn and roll around and not feel like they're stuck having all the little patches on their head like happens with a lot of other sleep tests. So it's a lot more comfortable to wear, and we try to make it an affordable price. It's substantially less than going to a place to sleep and to be monitored by somebody. So and then we put that fee towards the total amount, so that if you do end up moving forward to get the sleep appliance, that fee goes in with that. So a lot of patients are really happy with that. So with dental insurance, unfortunately, they're not covered. Once again, it makes sense because we're treating a medical condition. But the really neat thing is our office, Holiday Smiles and Sleep Better Utah, we actually bill a lot of procedures to your medical insurance. Dental implants, believe it or not, bone grafts, membranes for implants are being covered a lot more by your medical insurance. And not too many other offices are doing that. So it's a huge benefit to people, because then that's less out of your pocket, which is our goal. But your medical insurance, we will bill it to your medical insurance if you want. Billing it to your medical insurance is nice. We've have received checks from medical insurances, which has helped patients having to come up with less for their co-pays. So it's helped out a lot for a lot of patients to have their medical insurance cover these appliances. And the other nice thing too is the company covers these for a 2-year warranty, which is nice, and a lot of insurances cover them every 2 years. So we have patients who will have one made and then 2 years later have another one made, just in case if they stepped on it or they lost it. So it's nice to have a backup. Once again, the sleep test itself is a one-night test. So when you walk out with the sleep test, you'll come back that next day. I will get the analysis, and I have my sleep physician. He'll give me the results in 24 hours. And then when you say, yes, I want to do this, then what we do is we have you come back in for a clinical exam. That takes about 20 minutes. And then we also get you in that position, like I said, the 70% of your maximum protrusion. And then we take a CT scan, and this isn't the medical grade CT scan where it's a lot of radiation. The radiation is compared to being on what the radiation you get on a 4-hour flight. So it's a very nominal amount of radiation. That's one thing that we always try in our office, is to get the lowest dose of radiation with the maximum benefit from that. But after that, we send it to Germany, and once again, pending that there's no bad impression portion, which with this company, like I said, they fit 100% of the time thus far. It takes about 10 working days to get this back from Germany. Then you come back in for a quick delivery visit where we try it in. I make sure you can take it on and off and put it back in. And then I go over what to expect for those 3 weeks where you're a little sore in the jaw and also the tightness. And like I said, we've done a number of these, but everyone has been very happy about their appliances.